everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're doing another care plan. So let's get into it. So this situation, our patient is breastfeeding. So a new mom is breastfeeding her day-old newborn for the first time. She is anxious and says she is not sure she's doing it right. She asks if it's normal to hurt. So this one actually has a very specific nursing diagnosis related to it, and that is ineffective breastfeeding. So ineffective breastfeeding related to maternal anxiety, right? So she's proving herself anxious about the whole concept of breastfeeding, which is normal, right? Most first-time moms are very nervous about it. So our goal, the patient will express confidence in her ability to breastfeed by discharge. And I said by discharge because it's not realistic that she's going to do it once and be like, yep, I got it, I know exactly what I'm doing, right? So we need to give her some time. So by discharge is a realistic time frame for this goal. And there's a million different interventions we could use for this one, but I chose to encourage the patient to relax during feedings, inform her that breastfeeding is a learned behavior for both mom and baby. So it's something new. They've never done it before. She's never done it before. Baby's never done it before. They both need practice. And our rationale, letting the patient know that breastfeeding does not always happen instantaneously helps reduce anxiety. And this happens all the time. A lot of times women will get really discouraged if it doesn't happen right away and they're not great at it right away, right? Because they feel like, oh, this is natural and why can't I do it? There's something wrong with me. And it's not, right? This is something you have to learn. It's something that takes practice for mom and for baby, and that's okay. So this is a very appropriate intervention for this patient. And then with our evaluation, we can say that our goal is met. The patient was able to express greater confidence in her ability to breastfeed by discharge. Our second diagnosis, we have to talk about the pain, because she says, is it normal for it to hurt? No, it's not normal for it to hurt, right? So we need to address that. So our diagnosis is acute pain related to breastfeeding, because that's the cause of the pain, as evidenced by the patient asking if it's normal to hurt. So she's letting you know that this is causing her pain. So our goal will be the patient will state that she is not experiencing any nipple or breast pain by discharge. Our intervention, to instruct the patient to break suction by inserting her finger into the newborn's mouth before pulling the newborn away from the breast. So what happens is a lot of times first-time breastfeeders, when they're done, like baby's done eating, they just take the baby off the breast, and that can cause tissue damage and pain for the mom because it's like a little vacuum that you've just pulled off. So the proper way to do it is to insert your finger into baby's mouth to break that suction. So our rationale for picking this is it will decrease the risk of injury to the nipples. So that's why we picked this one. And then our evaluation, we can say that our goal was met. The patient was able to state that she's not having any breast or nipple pain by discharge. And then also with this one, she was able to demonstrate this technique, okay? So to break suction as instructed by the nurse, so to safely do it. So that was my video on a breastfeeding care plan. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.